the faculty at Nationwide Children's Hospital in Columbus, Ohio, here to talk about oral food challenges for food allergy. This webinar is offered by Kids with Food Allergies as part of its Education Outreach Program. I'm Linda Mitchell, Senior Vice President at the Asthma and Allergy Foundation of America, or AFA. Kids with Food Allergies is a division of AFA. I have the privilege of being your moderator this afternoon. Guest presenters for all of our webinars are doing so as volunteers without compensation. They also prepare their presentations based on the clinical evidence. On behalf of AFA and KFA, I'm very grateful for Dr. Mikhail to donate her time to be here with us today to discuss oral food challenges. Many of us here today are hoping that someday our children may outgrow their food allergies, so it's important for us to learn how oral food challenges fit into this picture. I thank you for joining us here this afternoon. I have a few housekeeping details to run through before we get started. First of all, today's webinar is made possible through a sponsorship from Mylan Specialty. We rely on donors and corporate partners like Mylan Specialty for the financial support that enables us to develop educational programs for families. Next, please remember that this webinar is of a general nature only and is not medical advice or legal advice. You should consult your own physician for any medical advice you seek with regard to food allergies and any other medical conditions. Today's webinar is being recorded. And later in today's webinar, we will stop to give away some wonderful gifts from our corporate supporters, Sun Butter and Applegate, valued at $20 each. The recipients of these gifts will be picked randomly from those still in attendance later in the webinar. There is a new handouts feature on our webinars that will allow you to download relevant documents directly from the handouts module on your control panel. So take a look at your control panel and you can see that now. We have 3 of them loaded for you. And if you don't get a chance to download them, it's not a problem. We will include links to these handouts in the email follow-up you receive a few days from today. And when we end this webinar, you will see a survey. Please share your impressions with us, as we will take your feedback very seriously to know how we did and to improve the future direction of our webinar series. So what I'd like to do now is introduce our speaker, Dr. Irene Mikhail, so we can get started. Dr. Mikhail is a member of the section of Allergy and Immunology at Nationwide Children's Hospital in Columbus, Ohio. She is also on the faculty at Ohio State University's Allergy and Immunology Fellowship Program. Prior to joining Nationwide, she worked at Children's National Medical Center in Washington, D.C. and the National Institutes of Health in Bethesda, Maryland. She loves improving the quality of life and safety for children with allergies, asthma, and eczema. However, she has a particular interest in treating children with food allergies and performing research to increase our understanding of the development and treatment of food allergies. Outside of work, she tries to keep up with her husband's busy schedule as an oncologist and enjoys spending time with her 2 girls ages 2 and 3 years old. So without further ado, I'd like to thank Dr. Mikhail, and we can get started.
Hi, everyone. I am so happy that you took the time out to be with us today. This is a topic, as Linda mentioned, that is very near and dear to my heart because I think it's one of the most valuable tools we can offer our children is the opportunity to see that they have outgrown their food allergy. So I'm going to just quickly go through some of the questions that you answered as we were logging on. The first question is, has your child ever had an oral food challenge? And we see about 1/5 of the people on the poll have had an oral food challenge. So 23% answered yes. And then our next question is, what are kind of people's concerns about an oral food challenge? And not surprisingly, the very first answer is the one that had the most responses, and that's whether or not there will be a reaction during the test. We obviously live in fear of our children having an allergic reaction, so that is very understandable. And then a lot of other people said that they can't find an allergist or that they're concerned their child's not even going to eat the food, even if they pass the food challenge. And then our last question had to do with what are some reasons that people have declined food challenges in the past. And again, the biggest reason is that people are too nervous, and likely they're just too nervous of their child having an allergic reaction. So with that, we'll just go straight on into our talk. So briefly, I just want to let you know what we're going to talk about today. We're going to start by just talking about what is an oral food challenge and when is a good time to consider doing a food challenge. And then I want to spend some time really talking with you about how to prepare for a food challenge, what to expect during a food challenge, and end with, well, what do we do after a food challenge? What do the results mean for us and for our children? So let's make sure we're all on the same page here. When I say a food challenge, what am I talking about? Well, one thing I can just say up front is the food challenge is really the most reliable clinical test or clinical procedure we have for diagnosing a food allergy. And what it really boils down to is giving a patient a food that they may or may not be allergic to in a supervised or controlled setting. It kind of goes against everything else we do as allergists. Everything else we do as allergists is teach people how to avoid the foods they're allergic to. And here we are in a food challenge, bringing them in to give them the food. So one thing that I want to really highlight in here is that we do so in incremental doses. So when we bring someone in for a food challenge, we start with very small amounts of the food in question. And the other big thing is that it's a supervised, controlled setting where everybody is watching, everybody is prepared to treat for a reaction, everyone is comfortable treating for a reaction. And those two things, the incremental and the supervised, is really what makes a food challenge very different from eating the food at home or trying the food on your own. Again, some terminology just to make sure that you might have heard these terms before, and I want to make sure everyone is on the same page. When your child or when a person having a food challenge eats the full serving of food, they have no symptoms, no evidence of an allergic reaction, we consider that a passed challenge. Ironically, that's termed a negative challenge, and what that really means is it's negative for food allergy, that the person doesn't have a food allergy. But sometimes that terminology can be a little bit tricky. On the other hand, if someone exhibits any signs or symptoms of an allergic reaction during the challenge, we consider that a failed challenge or a positive challenge. And I know what you're thinking. There's absolutely nothing positive about having a failed challenge, and I do agree with that, but the terminology really has to do with it's positive for food allergy, or we really were able to identify and confirm the presence of a food allergy. There's lots of different kinds of food challenges. So starting with the most controlled is something called a double-blind, placebo-controlled food challenge. In that kind of food challenge, the patient and the doctor don't know what the child is eating or what the patient is eating. They might be eating the food they're allergic to. They might be eating something else. Those are the most rigorous food challenges and the most sensitive or the best at really eliminating any sort of anxiety or bias, but they're rarely done in the clinical setting, but usually they're done in research settings. So if you've ever considered being a part of a research study for food allergies, you might be given more information about a double-blind trial. There are also single-blind food challenges, and in that, the doctor knows what your child is eating, but your child's not sure. Your child doesn't know. So some of the doses will contain the food they're allergic to, and some of the doses won't contain the food they're allergic to. This type of challenge can be helpful in a child that might really have a too much anxiety that would make it almost impossible for them to actually eat the food. But again, they're not the most common challenge that's done. The most common food challenge that's done, and really what I'm going to be talking about for the rest of today, is an open office-based food challenge. That means you come in for the food challenge, your doctor knows what you're eating, you know what you're eating, your child knows what your child is eating. And then the last two things, one that I wrote on here is a supervised oral feeding, and that means you come into the doctor's office and you eat a full serving of food in the controlled setting. Those are rarely done, but in some circumstances, some doctors might do them for various reasons. And the last thing you might have heard about is an at-home food challenge. I'm really not going to spend any time talking about an at-home food challenge because I think the reasons for doing this are very rare and really need to be discussed in detail with your physician. For the most part, an oral food challenge should be really done in a supervised setting. So why do we need food challenges? This question comes up a lot. If the whole point of the food challenge is just to see if someone is allergic to something, aren't there any other safer or better ways to get that information? And unfortunately, there really are not. What we have learned for various tests, various studies over and over again, is that having a history of an allergic reaction does not always equal true allergy, and that allergy tests do not always equal true allergy. So your child may have a history of a reaction, may have a definitive allergy, and over time they may outgrow that allergy. Unfortunately, the testing isn't always reliable to let us know that that has happened. And so that brings me to the next point of when or why would we consider a food challenge? And again, that falls into two major categories. One is to confirm the initial diagnosis of a food allergy. So sometimes some people have a reaction that is very obvious. Your child might have eaten a peanut butter sandwich for the very first time and developed lip swelling, hives, and trouble breathing a few minutes later. That's very clear cut. You don't need any more tests. To be honest, you don't even need lab values at that point. You know your child has a food allergy. Other reactions are much more vague or much less clear-cut, or somebody might have had a reaction after exposure to multiple foods. So at a seafood buffet or at a Chinese buffet, and they have a reaction, and we're not sure really what triggered it, or a reaction that's unclear or ambiguous. Sometimes we do a food challenge to help with the initial diagnosis. More commonly, though, we do a food challenge to see if someone has outgrown their food allergy, because we do know many, many food allergies are outgrown over time. So how do we decide if someone is ready for a food challenge? Well, before that, we want to kind of talk about, just because obviously in keeping in mind that you might do a food challenge, what are the risks of this? Well, the most obvious risk, and I think it's the one that people are the most concerned about, as we saw from our polls at the beginning, is you're subjecting someone to the risk of allergic symptoms. So they may have hives or swelling or trouble breathing or coughing or vomiting. And not only are you subjecting them to the discomfort of an allergic reaction, you're putting them at risk for a severe reaction. You're putting them at risk for anaphylaxis. And obviously allergic reactions and anaphylaxis are risky and they're physically uncomfortable, but they can also cause a lot of emotional distress. And those are all things that people are concerned about. There's also the small risk that when someone introduces a food back into their diet or has a food challenge, that they might have a delayed reaction. So maybe their eczema has been under very good control, and now all of a sudden your eczema starts flaring up. So these are all very valid risks, and they're risks that I think we all, the physician and the parent, need to understand before the food challenge. It's good to know that when it's been systemically studied, food challenges are actually quite safe. There's been no evidence of a death or a serious adverse event from a food allergy since we started reporting these things in 1976. And there's been no evidence that having a food challenge could delay the resolution of a food allergy. With all of those risks I talked about, some people might be ready to sign out of the webinar right now and say, why would anybody consider doing this? And like everything, we can't just look at the risks. We also have to look at the potential benefits. So I want to separate this out into two categories. There's definitely the benefits of having a past challenge. So your child eats the whole food, they have no reaction, and now you know that they're not allergic to it. Well, the big benefit is now they don't have to avoid the food anymore, so it avoids unnecessary food elimination. And along with that comes improved quality of life, less anxiety about food allergies, increased nutritional options. That's very important for kids that have multiple food allergies, and decreased medical costs. Decreased, you don't have to fill your EpiPens, you don't have to read labels, you don't have to buy special products, you don't have to worry so much about when your children go to birthday parties or Christmas parties or whatever it is that you might be celebrating. So those are all big benefits, particularly in children where their food allergy might be causing a lot of anxiety. There might also be some benefits to having a failed food challenge, or a food challenge where someone does develop an allergic reaction in the middle of the challenge. And one big thing is it could actually, ironically, decrease anxiety. A lot of times when someone knows what they're dealing with and it's no longer something in the unknown realm, it becomes something less scary. And it might also lead to better adherence. So there might be some people in your family or some caregivers that might be more lackadaisical about your child's food allergy, and after a food challenge, they might become more vigilant about understanding the severity of the food allergy. So putting all of that together, this just kind of shows how we're always kind of trying to balance these things. We're trying to balance the risks and balance the benefits to come up with the right time to perform a food challenge. And we really base that decision about if we're going to do a food challenge or not on 4 major things. And that we can move on to the next slide to talk about those 4 major things. So the first thing is, and I really put this at the beginning because I want to stress the fact that there is no right answer for when a child should have a food challenge or not. It depends on lots of different variables, and no one knows you, your child, your family better than you do. So your preferences are very important. And then on top of your preferences, there's the history, the medical history of your child. There's your child's lab values, which are very important, but are also only one piece of the puzzle. And then finally, there's the available resources. So when I talk about your preference, what I want you to take into account is how much is this food allergy impairing your child? How much is it impairing your child's quality of life? How much is it impairing their nutrition? What's their anxiety level? What would a failed challenge mean for your child or for your family? All of that's really important. What's your comfort level with risk? The next thing is history. So what are some of the things that we look into when we're trying to decide if someone is ready for a food challenge? The first thing we always consider is the initial reaction. What happened and when did it happen? The other thing that's very important is, well, what has happened since then? Have there been some accidental exposures? Has your child accidentally had a little bit of the item and nothing happened? Has your child accidentally had a little bit of the item and had a terrible reaction? All of that's really important. We also look at other food allergies. That might really play into what I was talking about with the preference. If your child has a lot of food allergies, the nutritional impairment might be of great significance. If your child only has one food allergy, the freedom from doing a food challenge might also have great significance. And then lastly, which is really important for the safety of the food challenge, is what other medical conditions does your child have? The next thing we take into account are the lab values. And the main lab values we look at are the results of your allergy testing, and we do that both in skin testing and in blood testing. Then there's other things that we look at with the labs. The rate of change in allergy tests, what was the lab value initially and where is it now? Other kind of markers of allergy in your child, other types of tests, and the results of other allergens, especially allergens that are similar to the one we're considering. So a lot of times I'm asked, at what point, at what lab value do you do a food challenge? And whereas that is a very important thing, it's not just one lab value. We have to take the big picture into account. And the last thing is your available resources. And that really comes down to where is the challenge going to be done? What's the comfort level of the physician? What's the setting where the food challenge is going to be done? I know, unfortunately, there are a lot of families that would love to have a food challenge, but unfortunately can't find a good place to do that food challenge or don't have the resources to do that. And that's something we hope to improve overall. So it's not such an easy question when to do a food challenge and when not to do a food challenge. It's something that you have to talk about with your provider. But there are certain scenarios where it really does not make sense to do a food challenge. And I would say that's mainly if there's a high chance of failing the food challenge, if there's been a recent reaction to the food, or if the labs are highly suggestive of an allergy. The other time would be if your child has a medical condition that would affect the safety of doing the food challenge. It would affect the safety of treating them in case they had an allergic reaction. The best example of that would be if they have really bad asthma or uncontrolled asthma. It's probably not a good idea to challenge their body at that time. Other times would be if they have a medical condition that would confuse how we understand the food challenge. So if your child breaks out into hives every day randomly, you would really want that to be under good control before we would do a food challenge. And then the other big one is if the child's not planning on eating the food after the food challenge. So if you know your kid and you know they will never eat fish, they will never eat peanuts, if they're not going to eat it after the food challenge, it's not a good idea to do the food challenge because we really need the food to be a part of their diet after the food challenge. Because there are rare circumstances where someone can redevelop an allergy if they don't include it into their diet on a fairly regular basis. So it's kind of some of that background on when to think about doing a food challenge. What's the next step? What if you've decided it's the right time for you and your child to do a food challenge? What are our next steps? So the first thing is you want to prepare for the challenge. So I always tell families this. Make sure your child is healthy on the day of the challenge. And I know you don't have that much control over your child's health, but if you wake up on the day of the challenge, or you know a few days before the challenge that your child's not in their best health, it's best to call and reschedule the challenge. Even though I know sometimes people are waiting for food challenges for weeks and months and it's disappointing, it really is in the best interest of your child. You don't want to do a food challenge while they're having a cold, while they're having an eczema flare or an asthma flare, or in the middle of their peak pollen season where their allergies are just completely out of control. The next thing is your doctor is probably going to talk to you about what medicine might need to be stopped before the challenge. So usually, not always, but usually we ask kids to stop their antihistamines for about 5 days before the challenge. Those are medicines like Zyrtec or Allegra or Claritin. And we do that because we don't want to mask any early signs of a food allergic reaction. And sometimes these medicines can kind of suppress our body's ability to show us an allergic reaction right at the beginning stages. But that being said, a lot of times I'll have someone come in for a food challenge and they say, well, we didn't want to take any chances, so we just stopped all of the medicine. I really advise you not to do that because, like I said, we want your kid to be in their best medical condition on the day of the challenge. So we want to make sure that you continue their asthma and eczema medicine. The next thing is going to be preparing the food for the challenge, and that's something you'll decide with your allergist. Some allergist office prepare the food there. Other places will ask you to bring it in. The big thing is you want to have lots of different options for the food because you're not sure what your child is or is not going to eat. So I always say to have at least 2 options, and if you can have more than that, that's even better. And then the next thing, which is probably the most important thing just to make the challenge go as smoothly as possible, is you want to make the challenge environment as fun as possible. So bring the Elsa cup that they love to drink out of or whatever, fun plates or utensils that they have. Bring activities and games to occupy them for several hours. Your doctor will probably have some stuff available, a DVD player, activities and games, but you know your child best and you know what's going to be the best to kind of keep them distracted from what's going on. I have seen families kind of set up the room like a picnic setting and really try to make this as fun and exciting as possible. And then the big thing, which I know is much easier for me to say, is you want to minimize anxiety for you and your child. So even if you're kind of nervous about the challenge, you want to be careful that you don't let that on to your child. You want to kind of go into this confidently knowing that your allergist would not have recommended this if they felt it was going to be harmful for your child, that even if a reaction occurs, you're in a place that knows how to deal with it, how to treat it. They've done this before. And so you want to kind of keep your anxiety in control and have that pass on to your children so your children aren't anxious. You also want to prepare your child. So I wouldn't surprise them on the day of the challenge and say, guess what, we're eating peanut today, especially if this is a school-aged kid who's been avoiding peanut their whole life. That can be really stressful for them. So again, you know your child and you know when probably is the best time to prepare them for it. Maybe not 6 months in advance, but probably not the morning of either. So I've given you a handout, one of the handouts that has different foods that we tend to do and some suggestions for foods to bring in or examples of this. I'm not going to go through it here. It's something to really be discussed with your allergist, but just to give you a sense of when I'm talking about a serving size of food, this is what I'm talking about. So once you have the food prepared, excuse me, your child is ready, everybody is ready for the food challenge, what can you expect on the day of the challenge? So the first thing is plan to spend at least 4 hours, oftentimes more than that, at the doctor's office for the challenge. The doctor is going to come in, talk to you, perform a history and a physical exam like they do on any other visit, and you're going to need to sign consent for the challenge. Once all of that is done, the challenge is actually going to start. So what happens is your doctor is going to determine how much food your child needs to eat to be considered non-allergic, to be considered that they've passed the challenge. And then they're going to break that up into 5 or 6 doses or 5 or 6 pieces. We start with a very, very small amount. And the reason is it goes back to that first thing I was saying, is that we're doing this in incremental pieces. If your child has an allergic reaction during the challenge, we want to catch it as early as possible. That's always our goal, is to catch the reaction as early as possible. And then we usually wait about 15 minutes in between each dose before moving on to the next dose. So like I said, you're going to start with these tiny, puny little pieces, and then by the end, the serving sizes become a lot more substantial. Some doctors, once they finish that part, will give you an open feeding, which means they'll just let your child eat however much they want. Other doctors don't do that. So during the challenge, before every dose, your physician or the doctor or the nurse or whoever's performing the food challenge is going to be observing your child in a way that minimizes anxiety. So I personally, when I'm doing the food challenge, I don't go in and do a full exam in between every dose, only because I find that raises the level of anxiety. Too much anxiety can be very harmful for a food challenge. A lot of the symptoms of food allergy can also be induced by stress or by anxiety, and it can get very confusing. I also want the experience to be as as unstressful as possible for the families. So I normally will go in between doses and talk to the family, talk to the child, stay in the room for a few minutes, and kind of observe them that way before giving them the next dose. And after your child eats everything, they're going to be observed for 1 to 4 hours. Usually it's about 2 hours, to make sure that there isn't a delayed reaction or something that happens afterwards. So I kind of talked about when I'm observing the child as I'm giving them doses, I'm looking to make sure they're not having an allergic reaction. Again, kind of walking, and this is where I think the experience of the provider comes into play. You're walking a fine line. You don't want to stop the challenge for anything that the child might do. You don't want to stop the challenge too early and to confirm an allergy if there really wasn't an allergy. But at the same time, you don't want to continue the challenge too long and miss some early warning signs that the child is reacting to the food. So what I mean, just to give you some examples, sometimes some kids might break out into some hives when the food touches their skin, and the hives will go away on their own. In that scenario, I probably would continue the challenge. Other time, kids might break out into a few hives, and I'm not really sure if this is the beginning of an allergic reaction or if this is just something transient that their body is doing, maybe because we've stopped their allergy medicine. So I'll wait a little bit. I'll wait 20 minutes or so. If the reaction completely goes away, I'll continue. If, however, we start noticing hives appearing in other areas on the body, then we'll stop the challenge. So if anything happens in the middle of the challenge, any reaction happens, it would be considered a failed challenge. So obviously, if your child has anaphylaxis, there's no waiting, there's no observing. They're treated. They're treated immediately. Usually the medicine is available in the room and ready to treat as promptly as needed. If there are more subtle signs of an allergic reaction, those are treated appropriately, whether it be with observation or whether it be with Benadryl or steroids or something else. The other kind of point to make, especially because now we are doing food challenges in younger and younger kids, because there's a lot of evidence to suggest that's probably the best thing to do to prevent their occurrence of allergies, is that the findings in kids that would lead to a failed challenge can be very subtle. So children can't verbalize, an 18-month-old can't verbalize, my mouth feels itchy or something feels funny. So they might suddenly become very clingy. They might suddenly start refusing to eat the food when they were so eager to eat the food earlier. Or they might just kind of want to hang on to their parents and not do anything else. So we look at all of that and kind of make a decision of this is probably an allergic reaction, and that would be considered a failed challenge. Other potential outcomes from the challenge is the child eats the whole food, nothing happens, and they would be considered a past challenge. And the third scenario which unfortunately does happen, is what we call indeterminate. And there's two main ways this happens. One is the child refuses to finish the food. You tried all of your tricks, your bribes, the different options you prepared. I've had child life come up sometimes to try to play with the kids and distract the kids. And some kids will just not finish the food. And if that's the case, then there probably is no point in continuing with the food challenge. The other thing that can happen is your child can have vague symptoms that we're really just not sure if it's related to the food or related to something else. But for the safety of the child, don't feel it's the right and the best interest to continue the challenge. And I kind of talked a little bit about how failed food challenges are treated. Like I said, the idea of a food challenge is to catch a reaction early on and to treat it promptly. And a lot of studies that have shown outcomes of serious reactions or bad outcomes from food allergic reactions, they're almost always related to the delay in treatment. So we're really trying to prevent that from happening. Depending on the reaction, treatment is going to vary from observation to giving Benadryl to giving epinephrine. In some situations, your child might need to be transferred to an emergency room or transferred to a hospital, but these are very rare circumstances. In fact, I've been doing food challenges for several years, and I've never had to transfer someone to an emergency room or a hospital. And that's not to say it can't happen or it won't happen, but it is definitely not the usual thing to happen. So what do we do after the food challenge? Let's start with the best case scenario. Your child passed the food challenge. So this is my practice. I don't know if it's everyone's practice, but I usually will say to avoid the food for the rest of the day. The reason is in extremely rare circumstances, there might be a delayed reaction later on that day, and I don't want to load the child up with so much food if that's going to happen. I also usually give them a pretty hefty serving of the food while they're in clinic, and I don't want their stomach to, react badly with giving them more food after they leave and then they throw up and we're not sure why they threw up. And I will always say to have, even if this is your last food allergy, to have epinephrine available for the rest of the day. So I normally don't let patients leave the clinic until I know that they have their epinephrine available with them. Just a safety precaution to make sure that everything is safe for the rest of the day. But then, starting from the day after the challenge, I really encourage them to introduce the food into the diet. Again, I emphasize the fact, if your child is not planning on introducing the food into the diet, or if your child is unable to introduce the food into the diet, they still need their epinephrine, because in some circumstances, in a child who's predisposed to having an allergy, they can redevelop that allergy. And the other big point I try to impress upon families is you need to be still vigilant about the other food allergies that your child may have. Just because they've outgrown this one allergy does not mean they've outgrown all of their allergies. If interested, you can schedule other food challenges to answer that question. So what happens if the child failed the food challenge? You want to kind of continue doing what you were doing before the challenge. You want to continue to avoid the food. A lot of times I'll do a food challenge, and at the end of it, the families will say, well, at least now we know he can have a little bit of the food. Maybe the reaction didn't occur till the 4th or 5th dose during the food challenge. And that's actually not correct. So many things can affect the way our body will react to a food. And if you are allergic to a food, you want to treat it as an allergy and use the same vigilance you've ever used. If a child is sick, or if the child has done activity, or if there's anything going on in the body, it can just change the way the body would react to exposure with that food. So I say, again, having a food allergy is like being pregnant. You either are or you aren't. There's kind of no gray area. So you still want to carry your epinephrine at all times. You want to have it available before leaving clinic. Chances are, if you had a reaction during the food challenge, especially if it was a reaction that needed treatment with epinephrine, you're going to be observed for a longer period of time. But there is still always a very, very small chance of having a delayed reaction. And for that reason, you need to kind of be aware of that and have your epinephrine available for the rest of the day. Probably the biggest thing if your child failed a challenge is you might be very disappointed about this, because maybe you really had your hopes up that your child was going to pass this challenge. you want to still try to frame it to your child in a very positive way. You don't have to lie to your child. You can tell them, yes, I'm upset about it too, but at least now we know you're still allergic. At least we tried. You did a great thing. Be very encouraging to your child. Try to avoid using the word failed, because that brings up such a negative connotation, and your child didn't fail anything. Your child actually did a great thing in coming and doing this food challenge. So you want to just be sensitive about it. And then the other thing is, just because your child failed this food challenge, it does not mean they will never be eligible for a food challenge again. Obviously, you're not going to repeat the food challenge in a few weeks or a few months even, but allergies are an evolving thing. So if the lab values continue to change, it would be completely appropriate to consider repeating the food challenge in a few years. And I have had kids pass a food challenge after failing a food challenge. It happens all the time. So don't completely lose heart. So with that, I just want to kind of end with some take-home points. That food challenges are really an important tool. Sometimes they're underutilized because of the anxiety around them. But I hope to have impressed upon you that they're done in a safe way under guidance and experience. They can still be performed very safely. That being said, not everyone is a good candidate for an oral food challenge. We have to take different things into account. You want to make sure the challenge is performed in a safe place with an experienced physician. You want to really prepare for the food challenge by having lots of different options available for your child and doing the food challenge on a day that your child is in the best health possible. And you want, if your child passes the challenge, you want to make sure they introduce the food into their diet. And on the other token, if your child fails the challenge, you want to make sure that they continue to avoid the food. And you want to be sensitive with how to talk. So with that, I think we will move on to some of the questions that people had submitted. So one question we actually got a few different times is, go ahead.
Oh, I was just going to thank you for your wonderful presentation. We really learned a lot from it, and so if you want to just move right into the questions and answers, that's just fine.
Okay, sure. And I think we're still accepting questions, so if people have questions, you can type them on, and we will try to answer as many questions as we can with the time we have available. So the first questions are all allergist offices able to perform this test? Unfortunately, no. It really depends on the comfort of your allergy and the resources and staff available at your allergist's office. So some allergist offices have a great mechanism in place for food challenges, and they do them all the time. Other allergist offices are they're just not set up to do food challenges. So that's something I would talk to your doctor about. The next part of this is what type of allergies is this being done for? Really any allergy. So we do food challenges for, all of the common allergies we see in kids, peanut, milk, egg, wheat, soy, fish, shellfish, tree nuts, but also sometimes some, esoteric things or some rare foods, and we're trying to decide if it's a food allergy or not. Our oral is done for adults as well as children. Yes, challenges are done in both kids and adults. I know in the past we really have thought that if you maintained your allergy until adulthood, there's a very small chance of outgrowing that allergy. There's data that suggests people can still be outgrowing allergies into adulthood. So food challenges are a good tool for everyone. Next question, kind of still about where is the best place. Do food challenges have to be done in a hospital setting, or can they safely be done in an
Dr. Mikhail, we're having some audio problems, so if you could just back up and talk about the oral challenges.
Sure. To talk about which one? About where to do the food challenges? Okay. Can you hear me now?
Hi, Dr. Mikhail. I can hear you. I think maybe Linda's having audio issues.
Okay. Okay, so people were asking about, are all allergist offices able to perform the test? And I was saying, unfortunately, not all allergist offices have the capability or the resources or the staff to run food challenges. So, the follow-up question was, do food challenges have to be done in the hospital, or can they also be done in the allergist office? I would say it really depends on the food challenge and the experience of the physician. Some food challenges are absolutely safe to be done in an allergist office as long as that office has everything available to treat anaphylaxis. Other food challenges might be a little bit higher risk and would probably be recommended to be done at least in close proximity to a hospital. The next question, are food challenges sometimes done at home? Some allergists under circumstances might recommend what they call like a home introduction or a home trial of a food, and that's usually only recommended if the allergist believes it's safe to do. That would not be the case for any known allergy and you're trying to see if the child has outgrown the allergy. So once someone is documented to have an allergy, in my opinion, the food challenge should always be done in a supervised setting, regardless of what, at that point, regardless of what the labs say. This is another good question. Can the reaction, whether mild or anaphylaxis, appear hours after doing the food challenge? In general, no. In general, we expect a food allergic reaction is going to occur usually within 60 minutes of exposure to the food, sometimes up to 2 hours after exposure to the food, and that's usually why we observe. There are cases of what we call biphasic reactions, or a reaction that has two parts. So you have a reaction right away, and then you have another reaction 4 to 6 hours later. But it would be very unusual to have no reaction at all and then have your reaction 6 hours later or 8 hours later. However, that being said, not everybody reads the textbook and not everybody's body does the same thing. There can always be case exceptions, and that's why on the day of the challenge, I usually say don't give any more food and make sure you have your epinephrine available and you're observing your child carefully. Then the next question, how likely is it that you pass the challenge in the office and then have a reaction a week later? I would say that's very unlikely. What could happen is you can pass the challenge, introduce the food in the diet, and then notice a week later my eczema is a lot worse. Or you can have kind of a delayed reaction that's caused by a different part of the immune system. And if that happens, you want to call your allergist to discuss it with the allergist. But the good thing about not that there's ever a good thing about a delayed reaction, but usually those are not life-threatening. They don't have the potential to be life-threatening. This is another great question that we touched on a little bit, but how are food challenge handled with very young children who are not able to verbalize? Is 16 months too young to do an oral food challenge? I think there is no age that's the right age to do a food challenge. I think in some kids, starting as young as possible is not only a good idea, it could be a beneficial thing for your child. So I would say I don't think 16 months is too young, but you want to do the food challenge. You're probably a little bit more cautious with doing those food challenges and kind of more in tune to subtle findings that the child might have or might be expressing. But I mean, I personally do a lot of food challenges on young kids, a lot of times for baked egg or baked milk. And lately, after some studies that have come out recently about peanut allergy, I think we're going to be seeing a lot more peanut food challenges in younger kids. The next question, what do you do if your child doesn't want to do the challenge but you want them to? This is a very, very good question, and it's something we run into a lot. I'll never forget one time I was talking to a family about a food challenge, and the girl who'd been very engaged got off of the bench, went into the corner, sat in the corner, and just said no. And she didn't even want to hear us doing any, moving forward with the discussion. So this is definitely something that comes up a lot. I mean, there's a few answers to this. If your child is not going to eat the food during the food challenge and it's going to be a completely high-stress scenario, it's probably best to not do the food challenge, because if they're under so much stress and anxiety, it's going to be almost impossible to get through the food challenge. On the same token, even if by some miracle you're able to get through the food challenge, if they're not going to eat the food afterwards, it goes back to that same point I made, that if they're not going to eat the food on a somewhat regular basis, I would say once a week or once a month at the minimum, the food challenge is not a safe enough way to say they don't have the allergy anymore. You still have to be pretty vigilant in avoiding the food. That being said, I think there are ways to engage with children and to talk to them about what are you worried about, and try to, arm them with some other tools to kind of try to lessen their anxiety. I actually think the webinar next week is going to be about dealing with anxiety a little bit in children. So I think just because someone doesn't want to have this food challenge, it doesn't mean we can't talk to them about it. But if, in talking to them and dealing with your child, they're still pretty adamant that they don't want to do it, I think you're a little bit stuck. You can talk to your allergist about doing a single blind challenge where the child doesn't know, sometimes they're getting placebo and sometimes they're getting the challenge food, but that doesn't solve the problem about are they going to eat it after the challenge. I think that the next question, there was another question that dealt with this a little bit about a child that had a salmon allergy and then stopped eating and passed the food challenge. So our son passed a food challenge for salmon and then refused to eat it for months. Then he asked for salmon and he reacted to that. It's possible that he redeveloped the allergy in the fact that he didn't eat it for several months after passing the challenge. So there are cases, and it doesn't. I don't want to give the impression that this is something that happens all the time, but it is something that can happen if your body is predisposed to having an allergy and the body doesn't see it on a fairly regular basis. It can develop the allergy. People always ask about the time course. No one knows for sure, but I would say roughly it can take 4 to 6 weeks to develop an allergy. So at a bare minimum, I say to try to keep the food in the diet at least once a month. And then when will we know what the right time is for an oral foods challenge? How does the skin results and the blood tests help in deciding? So another good question. As we talked about, the lab tests are kind of a big part of deciding if someone is ready for a food challenge or not, but they're not the absolute thing. Some general principles are the larger the allergy test results are, so skin tests that are very big, blood tests that are very high, there's a very high chance of failing the reaction or failing the food challenge and having a reaction, so it's best not to do a food challenge in those circumstances. When the numbers are very low or the skin test is very small, that's a lot more reassuring that someone may pass a challenge, but it is definitely not absolute. I have had people fail food challenges or react during food challenges with almost negative lab tests. And then when it's in the middle, like when it's in kind of like in the range in the middle, it really depends on several factors, like what food it is and what the whole picture, what your child's whole picture is. We have decision points that help guide us. So there's, for different points, there's different decision points that we can say, when the tests are this number, there's a 50% chance of failing a challenge and 50% chance of passing the challenge. So that's when they're helpful, but they're never the only piece of the puzzle. I've actually stopped, I've been fooled too many times where I walk into a challenge thinking there's a very, very good chance they're going to react and they pass and they do great. And I've had other challenges where I think, oh, they're definitely going to pass and they react. So I always say there's a reason we do the food challenges in a supervised, controlled setting. Do you have more information about next steps after a failed oral challenge, specifically for milk allergies? So depending on what the food challenge was, so a lot of kids that are allergic to milk, and the same thing applies for egg, so a lot of kids that would be allergic to milk or egg can tolerate baked milk or baked egg, and that's essentially because you cook the food, you change the way the protein looks in the food, and the body might not be as able to recognize it as an allergen. So sometimes if someone does fail their milk challenge or fail their egg challenge, I might offer them a baked milk or a baked egg food challenge. It really depends on on the child or the scenario. And again, milk and egg, those are two of the allergies that kids do outgrow. I mean, all allergies kids outgrow, but milk and egg are very commonly outgrown. So just because someone failed, it doesn't mean they will never pass. It just means you have to wait a little bit longer. Once a challenge confirms an allergy, does that mean that all hope to outgrow that allergen is gone? Like I said, it does not mean that. It really depends on the food and the lab values. So certain foods you're much more likely to outgrow, like milk, egg, wheat, you're more likely to outgrow. Tree nuts, for example, you're less likely to outgrow. So someone who fails a tree nut challenge, I don't want to say they will never be offered one again, but they're not going to be offered one again probably, the next year. I probably wouldn't offer them one again shortly after, but milk or egg, I'd be more inclined to discuss a repeat challenge 1 or 2 years later.
Okay, I think that's the last slide, and I just want to thank you so very much for your wonderful presentation and your ability to answer all these questions that have come in. We have maybe like 2 more minutes that I can maybe pull out some more questions because a lot did come in, and some of them you've already answered. But in the case of multiple tree nut allergies, how do you handle the challenges if there's indication that more than one will be outgrown? Do you do them one at a time, like a month apart, or how do you do in terms of timing of challenges when you are thinking that the child has possibly outgrown multiple allergies?
So again, it depends on if it's a child who's reactive to multiple tree nuts, or the lab values are really highly indicative of allergy in multiple different tree nuts and multiple different families. I bring them in and do each one separately, like at least 2 weeks. I usually like to wait at least 2 weeks in between food challenges on the same child. If it's a child that is more of they were diagnosed with a tree nut allergy, and it's unclear which tree nut they're allergic to or which family they're allergic to, I might do 2 or 3 different families of tree nuts on the same day and do them a little bit more abbreviated. So it depends on the child, it depends on the lab values, and it depends on the history of reaction. In general, anything that they have reacted to or anything that the labs are highly suspicious for will have its own food challenge day.
Okay, well, thank you. And then for children who are undergoing like a baked egg or baked milk challenge, do you give the parents instructions about what to prepare and how to bake things to bring in, or do you provide that at the time?
So at this point in time, we're giving parents instructions and give them a recipe to prepare and to bring in. We're working with our cafeteria right now to have it available, so we provide it to the families. Almost all of our other foods are provided to families. The big thing is we want to know exactly how much they were able to eat. So we want the recipe to be made exactly the way we were told for it to be made.
Yeah, makes sense. Well, it's 5 minutes before 2, and I'm going to wrap up here. Thank you so much, Dr. Mikhail. I really do appreciate it.
Thank you, everyone, for joining us.
It's been wonderful. I'm going to announce the winners, so just bear with me. I have to find the names of everyone. They've disappeared off my screen. Okay, so the Sun Butter winners, congratulations, Steve Meredith and Amy Tinker, and Applegate winners, Ellen Rossetti and Amanda Helms. We'll be in touch with you. We've got your email address, and we'll find out confirm your address so that we can send you these gifts that you've won today. Thank you for joining us. So with that, I'm going to go ahead and move on to an important message about anaphylaxis, since we were talking about epinephrine and being prepared. Just want to always remind you to have 2 epinephrine auto-injectors with you at all times. We have a handout to help you learn about severe allergic reactions, and that's something that you can also share with others, friends, caregivers, loved ones. Check your handout module that we have in the control panel to download this helpful resource. And we also have a recently posted blog about biphasic reactions. It is worth reading to understand why it's important to carry 2 auto-injectors, so check out the blog if you've missed it, and we'll also include a link to it in the follow-up email that we'll be sending to each of you. Our next webinar is on food allergy anxiety, back to school, and more. We're going to be emphasizing child anxiety in this presentation, so I hope you'll join us with Dr. Jeanne Rosenblum on Tuesday, August 11th at 1 p.m. And we'll be sending you a registration link in the follow-up email for that as well. Um, Next is our Strides for Safe Kids Philadelphia. We have our annual event at Plymouth Meeting Mall, which is in the Philadelphia suburbs. It's a really wonderful event for families. We have a really nice turnout every year. We have vendors there with free samples, and I hope if you're in the area and wanting to make the drive that day, it's on a Saturday morning this year from 9 a.m. to 11:30 a.m. Next is information about our KFA online community. If you are unfamiliar with our online community, it's part of our website, and you can reach it at community.kidswithfoodallergies.org. It's been an active community since 2005 when we became a nonprofit charity, and I encourage you to join and participate. You can ask questions, get food and cooking help, other kinds of support that we're all here to help you with. So please join us and be part of our community if you're not already. And then as a wrap-up, I just want to say thank you so much for joining us here today. An archive of this webinar will be available next week sometime. We will be sending out a follow-up email with a link to the archived recording and some additional information to supplement this webinar and discussion. And in closing, I'd like to just tell you that Kids with Food Allergies is part of the Asthma and Allergy Foundation of America, the nation's oldest and largest asthma and allergy charity. If you found today's session valuable and would like to see more of what this to offer for you and for others, please consider making a donation to support Kids with Food Allergies sometime this year. So in closing, thank you so much for being here with us today, and we'll see you in a couple of weeks for the next webinar on food allergy anxiety. Thank you.